Number 1. Explanations and examples of anatomical or directional terms.
Directional terms are words that describe the position of one body part relative to another, and they are used to locate various body structures. Superior, toward the head or upper part of the structure. Example, the lungs are superior to the diaphragm. Inferior, away from the head or the lower part of the structure. Example, the gallbladder is inferior to the lungs. Anterior, nearer to or at the front of the body. Example, the lips are anterior to the teeth. Posterior, nearer to or at the back of the body. Example, the colon is posterior to the stomach. Medial, nearer to the midline. The midline is an imaginary line that divides the body into equal left and right hand sides. Example, the nose is medial to the eye. Lateral, farther from the midline. Example, the shoulder is lateral to the heart. Proximal, nearer to the attachment of a limb to the trunk, nearer to the origination of the structure. Example, the elbow is proximal to the wrist. Distal, farther from the attachment of a limb to the trunk, farther from the origination of structure. Example, the wrist is distal to the elbow.
Number 2. Body planes.
Body planes are imaginary flat surfaces that are used to divide the body or organs to visualize interior structures. The sagittal plane divides the body into left and right equal sections. The transverse plane divides the body into superior and inferior sections. And the frontal or coronal plane divides the body into anterior and posterior sections.
Number 3. Description of body tissues. Body tissues. A tissue is a group of similar cells that work together to carry out a specific function. There are 4 types of body tissues. Epithelial tissue. There are 2 types of epithelial tissue. The first one is the covering and lining epithelium, which is divided in 2, the shape of the cells and the number of layers. In the shape of the cells, there are the squamous, the cuboidal, and the columnar. And in the number of layers, there are the simple, the stratified, and the pseudostratified. The second type of epithelial tissue are the glandular, which is divided in endocrine and exocrine. The second body tissue is the connective tissue, which has 8 types: the loose, the dense, the adipose, the reticular, the cartilage, the bone, the blood, and the lymph. The third is the muscle tissue, which has 3 types: the smooth, the cardiac, and the skeletal. And finally, there is the nervous tissue, which is divided in 2, neurons and the neuroglia. Number 4. Definition of feedback system.
A feedback system is a cycle of events in which a status of body condition is monitored, evaluated, changed, remonitored, re-evaluated. Each monitored variable, such as body temperature, body pressure, or body glucose level, is called control condition. When any disturbance causes a change to a control condition, is called a stimulus. Parts of the feedback system. Receptor. Receptor is a body structure, such as a nerve ending or sensory receptor, that monitors changes in a control conditions and sends inputs, usually in the form of a nerve impulse or chemical signal, to a control center, which in the body is typically the brain. Control center. A control center sets the range of values within which a control condition should be maintained, evaluates the input it receives, and generates output commands, usually in the form of nerve impulses, hormones, or other chemical signals. Effector. An effector is a body structure such as a muscle or gland that receives output from the control center and produces a response or effect that changes the controlled condition. Almost every organ or tissue in the body can behave as an effector. There are 2 types of feedback system, the negative and the positive. Negative feedback system. Almost all homeostatic control mechanisms are negative feedback mechanisms. These mechanisms change the variable back to its original state or ideal value. Positive feedback system. A positive feedback system strengthens or reinforces a change in one of the body's control conditions. A positive feedback mechanism is the exact opposite of a negative feedback mechanism. With negative feedback, the output reduces the original effect of the stimulus. In a positive feedback system, the output enhances the original stimulus.
And finally, 5 and 6. Risk factors of skin cancer and osteoporosis, and activities to prevent diseases.
Skin cancer is the abnormal growth of skin cells that most often develops on skin that is exposed to the sun. Although it can also occur on areas of the skin that are not ordinarily exposed to the sunlight. The risk factors for developing skin cancer include the following: fair skin, a history of sunburns, excessive sun exposure, sunny or high altitude climates, having moles or precancerous lesions known as acne keratosis, a personal or family history of skin cancer, a weakened immune system, exposure to radiation or a certain substance such as arsenic.
Some activities to prevent skin cancer are: seek the shade, especially between 10 a.m. and 4 p.m. Do not burn. Avoid tanning and UV tanning booths. Use sunscreen. Apply sunscreen every 2 hours and 30 minutes before going outside. Examine your skin head to toe once every month.
Osteoporosis, thinning of the bones with a reduction of the bone mass due to the depletion of calcium and bone protein. Osteoporosis produces abrasion fractures, which are often slow to heal poorly. It is most common in nodular roots. Controllable risk factors include the following: hormone levels, dietary factors, lifestyle choices, as people who consume tobacco.
Some activities to prevent osteoporosis are: regular exercise such as strength, balance, and flexibility exercises. Healthy eating. Consume calcium because it's important to maintain strong bones. Consume vitamin D because it helps your body to absorb calcium. Avoid smoking and limiting your alcohol intake.